Today, I'm going to be answering a question that I get all the time from folks, and that is, who is this for? Who benefits from a nervous system approach? Because so many people come into my world wondering, could this help me? And so that's what I'm going to be answering today. And so if you don't know me and what I'm talking about, my name is Alyssa Wolf. I am a chronic pain specialist and the founder of the Chronic Pain Breakup Method, which is a 16-week program designed to help you beat chronic pain naturally using an approach that uses principles of neuroscience in order to retrain the nervous system. And so ultimately the question is, who would benefit from retraining their nervous system? Like, who would benefit from a nervous system or a neuroscience-based approach? And that is the question that I'm going to be answering today. So who benefits from nervous system retraining? The answer is, honestly, anyone who has had pain for longer than 6 months. And the type of pain doesn't necessarily matter because pain is pain. Your diagnosis doesn't necessarily matter because when it comes down to the mechanism of how pain actually works, when it comes down to how pain is really experienced from a physiologic standpoint, pain is pain. And when pain exists for a long period of time, there are very real changes that happen in the nervous system that cause pain to be amplified. And those changes happen in our peripheral nerves, which make our peripheral nerves more active and more easily able to fire, thus sending a danger message more often with smaller and smaller stimuli. Those changes also happen in our spinal cord, causing more of those danger messages to get up the spinal cord to the brain, thus making the pain feel more intense and feel more widespread. And also those changes occur in our brains. So our brain changes as a result of long-term pain, and those changes in the brain then contribute to the amount of pain that's experienced. And so when it comes to who would benefit from retraining their nervous system in terms of managing or treating their chronic pain, my answer is honestly anyone who has had chronic pain for longer than 6 months. And like I said, it doesn't necessarily really even matter if you have chronic back pain or degeneration or bone spurs, arthritis, your bone on bone, plantar fasciitis, carpal tunnel, neuropathy. Okay, it doesn't necessarily matter what type of pain you have or where you have pain, because all pain, physiologically speaking, when it comes down to how it works inside of your nervous system, all pain is the same. And based on pain neuroscience research and clinical studies and clinical trials, we know that we can address some of those changes in the nervous system. And so this is really great news for anyone who feels like they are just destined to be in pain forever because of their diagnosis or their condition. We may not actually be able to cure a bone spur or an autoimmune condition or a degenerative disc disease, but we can tackle the problem by going deeper and modifying the way that the nervous system is sending danger messages and creating and amplifying pain. Okay, and so ultimately, if you've had pain for longer than 6 months or a year, and you've tried all the traditional treatment methods, including physical therapy, chiropractic care, injections, medication, surgery, and other procedures, then all that stuff hasn't really worked for you, you didn't get that kind of long-term lasting relief that you were seeking, then 100%, I'm confident that you would benefit from an approach that addresses your nervous system. Okay, so let's see. George says, hi, never had any pain. All started after a big fight I had with my mother. Anger blocked emotions. Yes. So, pain doesn't necessarily have to originate after an injury. And so it just can kind of appear out of nowhere. And so sometimes that's definitely an indication that we have a nervous system related issue. It does not have to start associated with an injury, and sometimes it does. It originally is caused by an initial injury, and sometimes the injury can heal. Sometimes the injury continues to be problematic. It doesn't necessarily matter what the cause of the pain was originally in order for someone to benefit from this type of an approach, because no matter what, like I said, pain is pain. And when it comes down to the physiologic mechanism of how pain works, it is absolutely going to benefit you if you've had pain for longer than 6 months, no matter how it started, even if it seems to be an emotionally charged issue related to trauma or an emotional sort of event or a stressful event. Now, with that being said, the one thing I will say is really if your emotional problem, your mental health, or your trauma and those symptoms of mental health or trauma or emotional problems are bigger than your pain problem, then it's more important that you actually address your mental health issues, your trauma, your emotional problems first before you try to retrain your nervous system, because that will end up getting in the way of you actually being successful in terms of retraining your nervous system. Chrissy says chronic pain for over 35 years, headaches and migraines. So yes, this sort of an approach will absolutely benefit somebody who has headaches and migraines. But ultimately it comes down to it's the same type of mechanism when we experience pain, no matter where the pain is located or what type of pain it is and how it started. Okay, so then the next question ultimately comes down to, is there anyone who doesn't benefit from this approach? Is there anyone who this approach doesn't work for? Absolutely, right? And I kind of already mentioned those who have a bigger problem with mental health and trauma, like when that problem is a bigger problem than the pain itself, then they're probably not in a space to attempt trying their nervous system retraining, because it's just gonna, when that bigger problem is the mental health problem, that needs to be addressed first. And so this approach is also not for individuals who are closed-minded, who are unwilling to look at their condition from another perspective. This is not for people who are not interested in learning about human physiology and about how the human body works. And this is not for anyone who's looking for a quick fix. Okay, so those individuals who just want to be fixed, who are still kind of looking for that magic pill, this approach does not work for those types of individuals. And ultimately, this approach does not work for those who are not committed to doing the work, to making change and really only doing half the effort and expecting full results. So for those individuals who are not coachable, who are not willing to communicate when they're struggling, this approach is not for them. It's not for individuals who really expect to try something 1 or 2 times and then give up when they don't see results immediately. And this is the kind of approach where, because it's not a diet, it takes time to see improvements, but those improvements will come with consistent implementation. And so those who do not put in the effort consistently to implement the strategies and drills that are required to retrain the nervous system, it's not going to work for them because it takes time. And so this type of approach does not work for those types of individuals. And so if you're somebody who is open-minded and has an understanding that in order to start seeing real improvements in their pain, they need to actually play an active role in their healthcare, and also that it's going to take time, it's going to take effort, there's going to be ups and downs along the way and along the journey. And but if you're coachable and you're open to learning and you're interested in learning how to take care of your own health and your own well-being, then this approach is absolutely going to benefit you. Okay, that's all I have to say for today. So until next time, I am signing off.